Good afternoon. I'm Cindy Hall, President of the Women's Congressional Policy Institute. Welcome to this afternoon's discussion on global maternal health. We have held many briefings on this topic over the years, and we are very pleased to begin a new series of maternal health conversations this afternoon. Special thanks to the Bill and Melinda Gates Foundation for their support for this series. The Women's Congressional Policy Institute, or WCPI, as most of you know, is a nonpartisan, nonprofit, public policy organization whose mission is to bring together a community of bipartisan women policymakers and trusted partners to advance issues of importance to women, develop the next generation of women leaders, and foster a more effective and representative democracy. We work closely with the members and staff of the Bipartisan Congressional Caucus for Women's Issues. I would like to thank our congressional briefing co-sponsors, the leadership of the caucus, Congresswoman Brenda Lawrence and Debbie Lesko, co-chairs, and Congresswoman Madeleine Dean and Jennifer Gonzalez Cologne, vice chairs. Our thanks to Carrie Pelsman and the maternal health team at USAID, and Marianne Etiabet at Merck for Mothers and her team. We appreciated the assistance of several organizational partners who provided important input as we put this series together. JPIGO, which contributed the video you will be viewing shortly, Save the Children and World Vision, co-chairs of the Maternal, Newborn, and Child Health Roundtable, and CARE, one of our long-term partners. I would like to acknowledge Congresswomen Susan Davis, Lois Frankel, and Jackie Spear, and former Congresswomen Elizabeth Holtzman and Marjorie Margolis, who are in attendance today. Each has made maternal health a priority in their work. I also welcome Dr. Dorothy Fink, Deputy Assistant Secretary of Health, Women's Health at the Department of Health and Human Services, and Dr. Janine Clayton, Director of the Office of Research on Women's Health at the National Institutes of Health. I also would like to acknowledge Stacy Stewart, CEO of the March of Dimes and one of our board members who recently testified in Congress on maternal health. As noted in the invitation for today's discussion, only questions that were submitted in advance will be asked due to time constraints. We will be live tweeting during the briefing. We encourage you and others to do so as well using the hashtag WCPI Global Health. I am now very pleased to introduce Congresswoman Madeleine Dean, Democratic Vice Chair of the Bipartisan Women's Caucus. Congresswoman Dean is serving her first term representing the 4th District of Pennsylvania. She serves on the Financial Services and Judiciary Committees and is an advocate for women's health and access to affordable health care.
Well, thank you very much, Cindy Hall and the Women's Congressional Policy Institute. It's an absolute honor and privilege always to be with you, Cindy. Thanks for bringing us together. Thank you also to the partners that you just listed who are so important in getting the information out about the issue of women's maternal health. I want to thank Carrie Peltzman for being a part of this today, Dr. Marianne Etiabet, and of course, our Jennifer and my chairs, the co-chairs Brenda Lawrence and Debbie Lesko. I'm honored to be here to represent Brenda in part, and I'm delighted to be with you, Jennifer Gonzalez Cologne, my colleague and friend. It's very exciting that former Congresswoman Marjorie Margolis and Liz Holtzman are also, of course, an important part of this, a passion for this issue. Both have been very dear, kind friends to me and role models, frankly. So Marjorie and Liz, it's a pleasure to be with you today. I thank you, Cindy, for your introduction of me. I'm Madeleine Dean, Congresswoman from Pennsylvania's 4th Congressional District. I'm honored to serve as the Vice Chair of the Bipartisan Women's Caucus and to lift up the issue of maternal global health, particularly at a time of the COVID pandemic. Maternal health has always been a global issue and often in many places in crisis. So the issue of inequity and the devastating effects of what happens when we do not get fair health care, adequate health care to all women. We know what happens. As many as nearly 300,000 mothers a year die globally as a result of pregnancy. We've seen that COVID-19 causes disruptions to even the most advanced health systems in the world. Our own country is struggling to deal with this pandemic. And we know that the impact on low and middle income countries and people, women, those with pre-existing high maternal mortality rates, will be the hardest hit by this pandemic and the lack of access to care. Estimates show that low income and middle income countries could see an additional 12 to 56,000 maternal deaths over just 6 months due to restricted access to healthcare caused by COVID. As policymakers, we have to work in a nonpartisan, bipartisan way to consider not just immediate health consequences from COVID, but also the indirect consequences, such as limited access to routine maternal and child health services, hunger, reduced access to food. In my own backyard of Philadelphia, the data shows that Black and Latino pregnant women are 5 times as likely as their white counterparts to have been exposed to coronavirus. These statistics are alarming, given recent analyses that pregnant women infected by the coronavirus might be at higher risk of worsened outcomes. And in the United States, Black women are 3 to 4 times more likely than white women to die during or soon after childbirth. We have to put more attention to this. We have to put more resources toward this in order to save lives. And I'm very mindful of the recent order by the administration to divert hospital data from CDC to the White House. We need to make sure that hospital data, which will include impacts on maternal health, goes directly to the scientists. Certainly share it with the White House. It's valuable information, but we must be absolutely transparent in what happens in terms of maternal health, in terms of all of our health during this COVID pandemic. So I'll fight. I'll continue the fight. I'm delighted to be here with Jennifer on behalf of our chairs. And I thank you, Cindy, simply for including me in this conversation.
Thank you so much, Congresswoman Dean, as always, for your thoughtful remarks and for your leadership on so many women's issues, not just women's health. We appreciate your being here.
Thank you.
I'm happy next to introduce Congresswoman Jennifer Gonzalez Cologne, the Republican Vice Chair of the Women's Caucus. Congresswoman Gonzalez Cologne was elected to represent Puerto Rico in 2016 and serves on natural resources, science, space and technology, and the transportation and infrastructure committees. She is an advocate for maternal and child health research. Congressman.
Thank you, Cindy. I really appreciate including us and be here with my friend Madeline. And as she just said, I'm representing Debbie Lasco today, our co-chair. But I think we do work in a bipartisan matter in every issue regarding women with Brenda Lawrence, Madeline, Debbie, and I. And for me, it's a privilege to be one of the co-chairs of this organization, the caucus. And I want to thank also the Women's Congressional Policy Institute for joining efforts today with the Congressional Caucus for Women's Issues in hosting this briefing on the critically important topic of global maternal health and the impact of COVID-19. And I'm sure every one of us are seeing those issues back in our states. As a matter of fact, I'm right now in Puerto Rico. So I want to say welcome to former members of Congress that are part of this briefing. And I think the group of people that are discussing this, I think this is the right time to do it. I think the COVID-19 pandemic has clearly changed life as we used to know it. It's every day is a different situation, and our new reality is posing considerable challenges for countries, including the states, to maintain the provision of high quality service, essential maternal and newborn health services. In that sense, It is well known that pregnancy alters the immune system of a mother, and given the fact that the majority of American women deliver in a hospital setting, it creates a unique challenge in the fight against the COVID-19. As a matter of fact, researchers at several university hospitals has concluded that our nation's maternal mortality rate is likely to increase just because of the spread of the coronavirus. I need to say that back here in my hometown, people are afraid to go to the hospitals just to be precautious of not getting infected because of the people that may be in the hospitals. So the pandemic is affecting pregnant women and mothers with newborn babies in many ways. Many are experiencing difficulties accessing critical pre and postnatal health services due to transport disruptions, lockdown measures, or simply because they are reluctant to go to health facilities due to the fear of an infection. According to the World Health Organization's every day in 2017, approximately 810 women died from preventable causes relating to pregnancy and childbirth. And this was even before the pandemic. Today, I think we're going to hear from our two distinguished speakers, Dr. Marianne Etivet and USAID Deputy Assistant Administrator Carrie Pelsman, on strategies that we could use to minimize the impact of the coronavirus, this pandemic, and on the lives of pregnant women and newborns, mothers and their babies. So I want to say thank you again, Cindy, to you for organizing this, and to all the panelists and the people who are part of this briefing. Thank you.
Thank you so much, Congresswoman. Thank you both. The Bipartisan Women's Caucus is an inspiration to all of us, and it is a place of bipartisanship and leadership on very important women's issues. And we thank you both for taking the time. We know this is a priority for you both, and thank you so much. I'm now pleased to introduce our moderator for this afternoon's discussion, Dr. Marianne Etivet. Dr. Etivet has 2 decades of experience improving healthcare outcomes for vulnerable populations and transforming healthcare delivery at the front lines. She currently is the lead and executive director of Merck for Mothers, Merck's $500 million global health initiative to help create a world where no woman has to die while giving life.
Thank you, Cindy, so much for the opportunity to moderate this important discussion. And thank you, Congresswoman Dean and Congresswoman Gonzalez Cologne, for your commitment to this issue and how important it is to highlight not just what is happening, but even more importantly, what we can do and what we can do now to save and improve the lives of women who are living through this pandemic all over the world. Imagine being pregnant today and facing the prospect of giving birth in a health facility overwhelmed by the coronavirus. These times call for renewed focus on community-based, client-centered care to ensure quality services that will reduce women's deaths from preventable causes and advance their health. A picture, or more accurately, a video, can say more than 1,000 words. And so I would like to start off by sharing with all of you a short video created by JPIGO with the support of the U.S. Agency for International Development that will help share with all of us exactly what's going on right now in the world. Thank you.
The health of a mother affects the health of her entire family, her community, her country, and our shared planet. While maternal deaths have declined by nearly 50% over the past 2 decades, women are still dying from preventable causes. And today, there's a new threat, the novel coronavirus. Whether a woman lives in Nashville, Nairobi, or New Delhi, she worries about how to care for herself and her family during this global pandemic. And she worries all the more if she's pregnant. Now, more than ever, a woman's health needs and our gains in maternal and child health must be safeguarded. One key, skilled nurses and midwives. They are on the front lines keeping women and their children healthy and strong. Backed by resilient health systems, nurses and midwives ensure that our 2 decades of progress building resilient, life-saving health systems survives the COVID-19 pandemic. Our gains start with a healthy pregnancy and childbirth. High-quality, respectful antenatal care, delivery with a skilled birth attendant, breastfeeding, and postnatal care. These remain essential to set a woman on the path to a lifetime of good health. Access to primary health care in a woman's own community and reproductive health services that meet a woman and family's needs are just as vital. And putting care directly in women's hands through new approaches and technologies will help us empower women to take charge of their health and their families. And when women are in charge, well, things get done.
Thank you, Cindy. I think all of us can see how that video brings to life what women around the world are facing as they seek not only essential information and services to stay safe and healthy during their pregnancy journeys. Many of you may know that Merck for Mothers was created back in 2011 when our company made a $500 million commitment to help create a world where no woman has to die giving life. The COVID-19 pandemic threatens our shared vision. It also threatens to undo much of the progress that has been already made towards achieving maternal health goals. We know that during the Ebola pandemic, that outbreak wiped out 28 years of maternal health progress in West Africa. Both congresswomen have already shared with us the disproportionate impact COVID-19 is having on women, many of them healthcare workers, as well as with our Black and Brown communities here in the United States. But we can learn from the past. And in the video, we shared just some of the work that a community of global partners committed to preserving the progress made in maternal and newborn health over the past 20 years is doing right now, so that history does not repeat itself. And so during today's discussion, I'm looking forward to doing just that, speaking with Carrie Pelsman to make sure that we do not repeat history. Carrie Pelsman is the Deputy Assistant Administrator for the Bureau of Global Health for the United States Agency for International Development, also known as USAID. Carrie is a senior foreign officer with 30 years of experience in public health, 2/3 of that with the agency. She has served in 6 USAID missions covering health, education, capacity development all over the world, including South Africa, Afghanistan, India, and Russia. I'd like to thank Carrie for joining us today and hand over the reins for her to share more about the important work that she and her agency are doing in global maternal health. Carrie?
Thank you. Good afternoon. Thank you to Cindy and the Women's Congressional Policy Institute for the invitation. On behalf of the U.S. Agency International Department's Bureau for Global Health, I would like to thank Congresswoman Dean and Congresswoman Gonzalez Cologne for taking time out of their busy schedules to join us today and express gratitude to Congress for its long-standing bipartisan support of USAID's maternal and child health programs. Our Assistant Administrator, Dr. Alma Golden, had really hoped to be here today, but she is taking some well-deserved leave. So I'm very privileged to be able to join you. I'd like to thank Marianne as well for her kind introduction and for her partnership. Merck has really been extraordinary in our shared objective of saving women's lives, for example, through the Maternal Outcomes Matter or MOMS initiative, a healthcare development impact bond in India, and Saving Mothers Giving Life partnership. Merck for Mothers has stepped up to support exciting work on life-saving medicines, maternity waiting homes, and local solutions, both internationally and domestically. We thank you for your leadership on maternal health, as well as your contributions to strengthen private sector engagement as part of the investors group of the Global Financing Facility for Women, Children, and Adolescents.
I'd also like to thank the Bill and Melinda Gates Foundation and the MNCH Roundtable for their partnership and support as well. And thank you to everyone who's taking time to join this important discussion today. The video, as Marianne said, was extremely powerful. Many of you are well aware of the critical importance of supporting maternal health programs in low and middle income countries. For those of you who may be new to this issue, I would like to provide a few insights into why USAID continues its efforts to end preventable maternal deaths in countries around the world. I'll also discuss the current impact of the COVID-19 pandemic on our maternal and reproductive health programs. Despite impressive progress in reducing maternal mortality over the past 25 years, more than 800 women continue to die each day from preventable causes related to pregnancy and childbirth. Many of these women live in lower and middle income countries. These preventable or treatable causes, such as infections, high blood pressure during pregnancy, complications around delivery, and severe bleeding after childbirth, can be addressed with high-quality health care. But expectant mothers face a myriad of challenges that hinder equitable access to skilled providers who can deliver high-quality care in health facilities. The challenges range from individual barriers, such as lack of financial resources to pay for care, to long-standing entrenched barriers within health systems. For example, while significantly more women are giving birth in health facilities, the health workforce has not increased to support this shift. The shortfall is particularly acute among nurses and midwives. Quality life-saving medicines are too often unavailable. More than 2 billion people rely on healthcare facilities without clean water, and 40% lack hand washing stations, both of which are critical for preventing infections. And transport and referral services for obstetric emergencies are often non-existent. As both of the Congresswomen flagged, routine data show that COVID-19 is causing disruptions in the delivery of essential healthcare and is preventing women from seeking care, often due to fear of infection. We have seen rates of antenatal care and facility-based deliveries drop, immunization programs stop, and access to voluntary family planning reduced. Pregnant women who are unable to access care or are opting not to deliver in health facilities have significantly increased risks of poor birth outcomes for both mom and baby. With respect to family planning, preliminary modeling suggests that a decline in the ability to access condoms and oral contraceptive pills could result in a 3 to 10% reduction in the number of contraceptive users and 156,000 to 7.3 million additional unintended pregnancies in our priority countries, depending on the magnitude and duration of the disruptions. For more than 3 decades, USAID has worked to ensure that all women and children have the same chance of a healthy life, regardless of where they were born. Our efforts focus on 25 priority countries that together account for more than 2/3 of maternal and child deaths worldwide. In 2019 alone, USAID helped 84 million women and children access essential and often life-saving health care. Improving equitable access to maternal and newborn care before, during, and after childbirth is paramount to USAID's approach to preventing maternal deaths. Over the last 4 years, USAID has helped more than 13 million women deliver their babies safely with a skilled birth attendant in a health facility. USAID's longstanding obstetric fistula program has reduced fistula and supported more than 50,000 fistula surgeries. Also critical to USAID's approach is ensuring that we listen to what women want in quality health care and support countries to include women's voices in their planning and policy making. Global findings from a survey of over 1 million women underscore 3 critical components of health care that women want: respectful and dignified care, clean facilities with water, sanitation, and hygiene, and essential medicines and supplies. USAID partners with governments, the civil and private sector, and other organizations to advance quality improvement programs and other grassroots activities in our priority countries to ensure the provision of high quality, respectful, and dignified care for women and their babies. I hope this provides a bit of an overview of why maternal deaths continue to be a problem and the efforts USAID is taking to save the lives of women around the world. The last mile of progress will be the hardest to achieve. It calls for intensified efforts, more targeted investments, and tailored solutions. What the global health community has yet to achieve will require all of us to work differently and more creatively. I'd like to end by acknowledging the work left to do here at home, where we have seen troubling increases in maternal mortality linked with inequities and racial disparities in our US healthcare system. I believe it is critical that we continue to dialogue and learn from one another's progress, both here and abroad. Thank you again. I look forward to our discussion.
Thank you, Carrie, and I really appreciate you providing a summary of the work that USAID is doing in this space. Would like to take the last 15 minutes of the briefing to do a brief discussion with you around what it is that we can do more. You mentioned that the last mile would likely be the hardest, and that's what's in front of us now. Can you talk a little bit more about what you have learned, in the last 30 years of doing this work, about what makes a success story and what makes a sustainable success story, and how you're going to take some of those learnings and findings forward for that last mile of progress?
Thank you. Great question. I think that we have work that remains to be done. It is an unfinished agenda. And I think supporting and encouraging care seeking among women, but also improving the quality of health services. So it's a supply and demand equation, and we need to focus on those. That's really the cornerstone of our approach to improving health outcomes for women. Quality of care, of course, is key, and I spoke about what women are looking for in health services to take advantage of them. It really starts with skilled providers who respect women, who have the drugs they need to support them, the commodities that are available, and an environment that allows for clean, healthy delivery. I did just want to touch on one item that ties in, I think, nicely some of the points in the video about nurses and midwives, and the issue around health systems and human resources for health. Since 2014, USAID has released an annual report titled Acting on the Call, which provides a summary of our programs and our progress toward preventing child and maternal deaths. And I'm just happy to share that the 2020 Acting on the Call report, so I'm going to do a little public service announcement if you'll bear with me, just came out this week. And in honor of the International Year of the Nurse and Midwife, that's the focus. It recognizes their invaluable contribution and the ways in which they support the effort to end maternal mortality and improve child mortality as well. Unfortunately, the report this year reveals that only 2 of our 25 priority countries have reached the global standard for the number of nurses and midwives per 100,000 population. So we certainly know that human resources for health, nurses and midwives play such a crucial role in access to care and in quality care, in the respectful care that we've spoken about. And the other elements, breastfeeding counseling, voluntary family planning, reproductive health care services. So those quality improvements, the training for healthcare workers, and human resources for health policies are all really fundamental for our work. So if you would be interested to see, if the participants would like to see the report, and it does capture some of the specific successes and programs, it's at www.usaid.gov/acting-on-the-call. That said, I would like to acknowledge, certainly now in the COVID pandemic, we have to acknowledge that the healthcare workers really are the frontline heroes, as well as our staff, our implementing partners who are working on the ground to address the challenging time.
No, thank you, Carrie. And what you said actually reminds me of an earlier remark you made about hand washing stations and how important those are, not just for reducing infections that can cause maternal harm and maternal death, but as we all know, are one are really important armamentarium in our fight against COVID. You also just mentioned right now the critical importance of human resources for health, midwives, nurses, and we know that our health systems are weak in many places and don't have those resources needed to surge and meet the demand of the COVID pandemic. I'd love for you to share a little bit about any opportunities you've seen to leverage work that's being done in the maternal health space to build more resilient systems that can support pandemic preparedness and responses. And conversely, because we know we need to be smart about how we do this work, are there opportunities to leverage the investments for pandemic preparedness so that they also contribute to achieving maternal health goals?
No, I think it's very interesting on your last point. You know, the work we've done on the global health security agenda, which also protects Americans here at home, has really laid the foundation for a lot of the work we're doing to support countries in their preparedness and their response to the pandemic. So when we look at things like digital technology, right, you sort of talk about how we address challenges in the health system. And we have the incredible new capacity, and USA just released a digital strategy for the agency. And we're trying to take advantage of those tools to sort of foster or harness innovations and technology to advance some of these. So for instance, I know in India, there was an app developed that's being used now to refer pregnant women to facilities where they're not seeing COVID patients, right? So that they are going to safer places to be able to access the safe delivery and healthcare that they need for maternal health and a safe delivery. So that's a way in which we can take advantage of technology and the incredible penetration cell phones and cell coverage have to get that support and information right in the hands of the population we're trying to serve.
Yeah, no, thank you, Carrie. And that again reminds me of this point of innovation. You mentioned acting on the call, and we know that this next decade, getting to the Sustainable Development Goals of 2030, we're really going to have to accelerate our progress if we're to meet those goals in all of the countries where we seek to. And COVID actually is accelerating the deployment of new technologies and new innovations. You know, there's the common phrase, necessity is the mother of invention, and we are seeing our frontline healthcare workers doing what they have to do in the moment to make sure that they're getting services and information, you know, to women in communities. How are you thinking about the role of innovation, including potentially partnerships with private sector, you know, to help accelerate, you know, the progress that we can make in the next 10 years? And also, I want to bring back to the points that both Congresswoman Dean and Congresswoman Gonzalez Cologne made about the disproportionate impact of COVID and how, if we're not careful, some of these solutions, especially these innovative technological solutions, may actually exacerbate some of the disparities that we're seeing in access to quality care. So I'd love for you to, you know, speak a little bit about how we can use innovation to both accelerate progress, but do so in a way that does not exacerbate inequalities.
So actually, you touched on the private sector, so I might just start there first, because I also think that along with a focus on digital strategies, the agency, USAID is very committed to private sector engagement and to transforming how we're working with the private sector. And I talked about a few of the illustrations with Merck from during my remarks. I think that, you know, that has afforded a whole new landscape of opportunities for us and engagement. And I'll just say as well, under our previous administrator, Mark Green, we underwent a transformation process, and one of those related to our procurement reform efforts that were undertaken. And part of that was to improve our engagement with the private sector and our ability to learn from and hear and take advantage of the expertise in the private sector. And I'm really pleased. We've just launched a new suite of awards focusing on maternal health called Momentum. And these were all developed with co-creation. So we brought together stakeholders, implementing partners, private sector experts, and really dove deep into what the needs were and how USAID could best respond. So I would point to that approach to engaging the private sector and intensifying and increasing that. And Momentum is one illustration, and the co-creation approach, I think, is something that we are pursuing quite extensively to ensure that we have engaged with the private sector. I think that getting to the issue about innovation and ensuring that it doesn't inadvertently intensify or exacerbate some of those challenges, you know, we're definitely looking at guidance to improve the access to services and things like distance learning. In the Philippines, we've started a program for healthcare workers to do distance learning on infection prevention control. So I think as of May, 7,000 healthcare workers had been trained. So that's another way to take advantage of technology, also to address the need for adaptive management and some flexible changes in how we're delivering services and working together with both the private sector. And then again, I think for us, and I would point to one of the lessons we learned with Ebola and Zika in terms of the need to engage the communities and build trust with the communities and ensure the messages are conveyed through communities and through appropriate channels in the communities. And so I think if we ensure that community level engagement and participation, that can also help break down and avoid some of the challenges that you've touched upon.
Yeah. Thank you, Carrie. And you mentioned earlier the partnerships that Merck for Mothers has had with USAID, and one in particular, you talked about the Moms Initiative, Maternal Outcomes Matter, which is bringing blended financing to social entrepreneurs in sub-Saharan Africa. And one example just comes to the top of my mind, an investment in a company called LifeBank that was started by a woman entrepreneur to bring life-saving blood products, to women so that they would not have to die from postpartum hemorrhage. And in the midst of the COVID pandemic, one of the things that social enterprise is doing now is delivering oxygen, to facilities and setting up mobile testing centers. And I think this just speaks to, that approach that you mentioned of strengthening health systems by integrating local private sector as well, so that, when there's an unexpected challenge, there's more capacity to be able to respond in the moment, to new needs. So I'm really excited about that partnership Merck for Mothers has with you, and seeing what comes, the results in saving lives that comes out of it.
Oh, I do think, sorry, I was just going to say, I think that the platform I mentioned of some of our work on global health security is true for many of our other partnerships, right? Many of those partners now are shifting, and the entrepreneurial spirit that led to their, winning a grand challenge or participating in another part of our partnership and our activities together, that can translate well into identifying new innovations and approaches in the time of COVID.
Yeah. One of the things I want to make sure we save some time to talk about is what's happening in the US right now, where 3 to 4 Black women are 3 to 4 times more likely to die due to complications during pregnancy and childbirth than white women. You mentioned that important survey, What Women Want, where that #1 ask was about respectful and dignified care. What lessons or insights, can you share about the efforts to ensure women receive respectful and dignified care? Are there things that we can learn from as we grapple struggle with our own high rate of maternal mortality here in the US and the stories we hear where women, especially Black women, are not being listened to during their pregnancy journeys.
So I very much appreciated the two congresswomen drawing attention to this point, and I want to acknowledge it. I don't work on domestic health, and so I think for me the key is, are there lessons learned, as you're saying, in what we're doing overseas that can be translated here back at home? And I think I touched on the issue of working with communities and developing trust. I think for us community health workers, and enabling them to do some of the direct service and the outreach and the communication and the home visits, and giving them the skills and the tools to be able to do so, that can convey so much and help to further that trust and communication. I definitely think that also overseas, we know that the majority of deaths do occur among poor, marginalized women. So I also think this points to the power of data and having those data to be able to translate them into evidence-based responses and approaches that can best get at those root causes and the challenges that result. So I definitely think this is a priority for all of us. I do happen to focus more globally, but there are definitely lessons that we all need to learn and communicate and share back and forth. And again, drawing attention to the challenges and issues is an important first step.
Thank you, Carrie. Before we end, are there one or two primary takeaways you hope that the policy makers attending this session will consider in their work?
So thanks. I think I might come up with three. One, we have had tremendous successes as a global community working together. We know the interventions that work and that are effective, but we still have a lot left to do, particularly with the challenges of COVID. And I think we definitely need to recognize and address the ways in which COVID could potentially challenge some of the gains that we have made and what we need to do to ensure that we don't risk losing those gains. I think finally, I'd like to thank Congress for its longstanding leadership, for its, again, bipartisan support of USAID's maternal health programs. I think along with our private sector partners, and again, I appreciate everything that you have done in your leadership at Merck for Mothers, and there's, we couldn't do what we do without the support of Congress and the American people. So I think that's a really important closing note. And then again, these opportunities to dialogue and share lessons learned that we can draw from one another and work together to achieve our important goals.
Thank you, Carrie.
Thank you.
Well, thank you both. This is always a problem when you have a great discussion going. It seems way too early to end this. And I do appreciate both you, Carrie and Marianne, for engaging us over the last half hour plus. And we thank you and your teams for your critical work to reduce maternal deaths and improve maternal health globally, particularly during the COVID pandemic. And you've both mentioned both the challenges, but also opportunities, and it certainly provided a lot of food for thought for policymakers to consider moving forward. I do want our attendees to know the conversation was recorded and should be available for viewing on our website at WCPInst.org later today. You will also receive an email asking you to fill out a survey about today's discussion, and we hope each of you will take a few minutes to respond. We may make some changes in the format and content for the next discussion, so your input truly is important. Our thanks again to the Bipartisan Women's Caucus leadership, members and staff, and the Bill and Melinda Gates Foundation for their support for this briefing series. Thanks again also to JPIGO for your excellent video and for the input from our other partners, including CARE, Save the Children, and World Vision. And finally, my thanks to Cheryl Williams, Cynthia Ramos, Julia O'Connor, and Chidebere Azubike for their work to make this briefing possible. Thank you so much.